Hello and welcome to 9 Months, India's first and only comprehensive show about pregnancy. My name is Meghna Pant and I've enjoyed being pregnant, but now I'm fast approaching D-date. Yes, the very dreaded delivery date. Although I'm very excited to hold my little bundle of joy, I have to confess, I'm also slightly nervous and afraid about the labor pains. If you're on the same boat, then do listen in, because I'm joined by top doctors across Mumbai who've guided thousands of women through labor and delivery. It's my pleasure to welcome Dr. Kurush Pagriwala, Dr. Munjal Kapadia and Dr. Ketan Parekh. Thank you so much for joining us here today. I'm going to start the one question that's on top of every woman's mind, which is how painful does labor get on a scale of 1 to 10?
Well, as you can see, none of us have experienced labor. But medically, the way we were taught, I thought dental pain and colics, renal colics, ureteric colics were the most painful situations. So if you give them a scale of 10, I think labor should be about 7 or 8.
Okay.
But it goes on for 8, 10, 12 hours or longer. So that's the big thing. A pain of 7 or 8 intensity going on for hours.
Exactly. Okay. What about you?
In my experience, I've learned that it's wisest not to comment on labor pain and how bad it can be. It doesn't work out very well at home and at work. So you just have to take your patient's word for it. Is it bad? Yes, it's very bad. Okay. And yes, I've had bad toothaches, and I made the mistake once of telling somebody, you know what, it can't be as bad as that. And the repercussions. Yes. So how bad is it? Pretty bad. Yeah.
Okay. Dr. Parekh?
Well, it is normally said that labor pain is one of the worst pain that a woman can experience in life. As Kurush said, none of us can comment on that, but that's what has been said. And normally it is extremely painful, and we always have a scale of 0 to 10 as a visual analog score. And every patient that I ask in labor, when they come in labor and ask for pain relief, where is the score? And it's always 9 and 10. So it's the worst pain that anybody can experience.
I've already pegged it at 100 right now. So Dr. Kapadia, when does, we see a lot of sort of signs as a new mother in movies and stuff, but when is a woman actually ready to go to a hospital?
Oh, it depends from mother to mother. For some women it would start with pain, and the pain could be painful contractions, or it could be backache. Okay. And it's more than a little mild backache, and the thing with the pain is that it would be in increasing intensity. It would increase in frequency every few minutes. For some women it's not pain, it's a little bit of discharge, a little bit of mucus with a little bit of blood mix, or somebody's water may break. Okay. For some it would be decreased movements of the baby. So anytime any of these warning signs start to occur near term is when you need to either get in touch with your doctor or head to the hospital.
Okay, that makes sense. Dr. Pagriwala, once a woman does come into the hospital, of course, the birthing method has been at the epicenter of so much controversy. Even me, I've got a lot of, unsolicited advice, in fact, sometimes, about what method to choose. So some say go for natural delivery, some say don't try to be a superwoman, take an epidural. Some say that for the safety of the mother and the child, a C-section is better. So in your experience, how do parents really decide, and is it really up to them? It's usually down to the baby and what happens at the hospital.
When you mean birthing methods, are you trying to talk about positions and water bath, water births or anything?
No, just C-section versus natural.
See, so far in the nomenclature, in the books, a vaginal delivery is still termed as a normal delivery. So C-section has not been labeled as a normal route for delivery as yet.
Right.
But, I mean, there are grounds where there is no alternative but a C-section.
Okay.
There are situations like a low placenta, a baby in a bad position, previous 2 or 3 C-sections, or severe fetal distress or whatever. So those are grounds where you don't tread on.
Okay.
Now in terms of kind of deciding as a choice, there are patients, and even abroad there are a group of patients and group of indications saying patient requests C-section.
Exactly.
Where we tell them that it's still a surgery. On a 1-to-1 it may not matter, but if you take 100,000 patients, the normal deliveries will have a better outcome.
Okay.
So I personally don't think that a patient should decide on a C-section against a vaginal birth if the situation permits vaginal birth.
Okay, that's good to know.
There should be no doubt.
Okay.
And I think over 7 or 8 months that a patient sees a doctor, if the doctor hasn't got the patient's confidence, I think it's something wrong somewhere.
Absolutely.
I think you have to just go by,
What your doctor
don't try and be an expert, don't make Google your alternative doctor,
Yeah.
you know. So I think basically have trust. When we take our car to the mechanic, we don't read up about car engineering.
Exactly.
He says, Saab, ye karna hai, we do it.
Yeah.
So that's the way it should be, I think. Beyond a point, trying to learn about everything through Google is only negative.
Yeah. So trust your doctor's advice.
Basically, I think over 8-9 months, that should have built up.
For sure.
That he is doing what is best for you and the baby under the circumstances.
Absolutely. And you know, Dr. Parekh, now most women are very anxious about labor pain. I think it's the stuff nightmares are made of. But we are not aware of how many options are available to us to relieve this kind of pain. So could you enlighten us on that?
Yeah, see, I mean, basically, there are a lot of options available for people to relieve pain, because pain is something very subjective.
Yeah.
What is very painful for your friend doesn't mean it is going to be same painful for you.
Right.
Or it may be very comfortable for your friend doesn't mean it's going to be same for you. So
Right.
you have to kind of come in the hospital with an open mind
Yeah.
and see how the pain is,
Okay.
and then take a call.
Okay.
And we have options. It's like a step ladder thing. You know, you climb on the first floor. If you're comfortable, you stay there. You don't need to go on the second floor.
Right.
So there are options available, like simple options like, you know, breathing exercise, Lamaze technique.
Yeah.
You got this aroma therapy, music therapy. Some people have some kind of a little oil in the room. They have some soft music playing. They have this ball, which is kind of a little physiotherapy type of thing. So lots of small options available. And if you are comfortable with that, fair enough, you can carry on with them.
Right.
These are all non-pharmacological, non-invasive options, which
Right.
are very comfortable, especially in the early stages of labor when the pain is just starting.
Okay.
And if you have a good threshold and you can take on with that, you don't need to worry about anything further, and just go on with your labor in using the same methods.
Okay.
If you're not comfortable, then you can go out to higher level, whereby we can give you some standard intramuscular painkiller injection, which is given for lots of other, you know, pain situation, like a post-surgery or something like that, where we can give you some painkiller injections.
Okay.
If you're comfortable with that, fair enough, it reduces the pain by about 30 to 50%, sometimes 60-70%, but not very comfortable and completely for a lot of women what they really want.
Yeah.
Then the option comes to as an epidural,
Okay.
which is scientifically proven and one of the best available option all over the world.
But it's still not as widely practiced as it is in the Western world.
Unfortunately, because of there are a lot of myths, a lot of doubts that are, you know, around the epidural.
Right.
Starting from patients' concern, because they feel that, you know, there are a lot of mother-in-law input.
Right.
And they say, if we did it, why are you trying to do something different?
Yeah.
So that's the first thing. Second thing is that a lot of people say, there is no pain, no gain. But I say, there is gain without pain. I mean, why should you have to have pain? If you have a headache, don't you just put paracetamol tablet without even thinking twice?
Exactly.
And the headache would be like scale of 1 or 2 on 10. When you have a pain of 10 for going to last for 10 hours, and if you still say that no pain, no gain, you know. So these are all wrong notions associated with it. Also, people are slightly concerned about complications associated with the procedure. Now, anything that you do is going to have its consequences. By and large, as I said in the beginning, epidural is the safest option available amongst all the options possible. So yes, it is a very safe thing. Of course, there are side effects associated with which are by and large manageable, not something that is very drastic.
Right.
A lot of time, you know, when we go for the epidural and patient's husband standing there and say, Doc, you think this is safe? And we say, yeah, it's quite safe. And then the next question comes, you sure this is 100% safe? And the answer to that is no. Because there is nothing that is 100% safe.
Of course.
Things can go dramatically wrong. You can take a vitamin injection, you can take a vitamin tablet, and you can have an allergic reaction.
Right.
So my answer to those kind of questions is, it is your choice whether you want to go to cross a road. There is road traffic accident happens every day on the road.
Exactly.
But by just worrying about a car coming and knocking you off, you're not going to cross the road ever. And all the best to you.
Exactly.
So, you know, those kind of accidents do occur, but they are very rare. In fact, there is a statistical study, there was a study done in the US that more women die reaching hospital in labor due to road traffic accident than taking epidural.
My God. Okay.
So the point is, there is an element of risk, but that's so less that one need not worry about it. And if you still want to worry about it, epidural is always an option. It is not a compulsion.
Of course. Definitely.
Also, some of the reason is that this facility is not available because there are not very many qualified people around to practice that, so it's not available widely. And that is where again awareness needs to kind of come in, because women are also not very much aware of the option.
Definitely. And talking about awareness, the C-section also is shrouded by a lot of sort of myth and misnomers. It now is, I think, constitutes almost 30 to 40% of all deliveries. Yet there are all kinds of myths around it that hospitals are just cheating clients and trying to make it a money-making scheme, or it's for the C-sections are for lazy mothers who are fitting it in between Pilates classes. So, Dr. Pagdiwala, now, in your experience, why is it imperative to remember that sometimes C-section may just be a good thing for a mother who's gone into labor?
See, what is the aim of going to a hospital and not delivering at home or wherever? So that the outcome is optimum both for the mother and the child.
Right.
Okay, so like I said, professional decisions you leave to the professionals.
Yes.
Now, if you're trying to ask as to why C-section rates were 10% 25 years ago and why they are 40% now, you got to understand that as Indian women of around 5 feet plus average height, we are not meant to deliver 4 kilo babies.
Okay.
Most of the women are delivering 3.7, 3.8, 4 kilo babies. So there's going to be a need for C-section there.
Okay.
Test tube babies, which was once affordable only to the super rich, is now at 125,000 rupees a cycle, which an average person can access. So test tube babies with multiple births, twins, triplets, all that adds to an increasing C-section rate.
Okay.
Now, if you go back to your grandmother's generation, they would talk about, oh, I had 7 children, I had 2 losses in labor, one of my 7 child died in the 3rd month. They took things in their stride.
Right.
Now everybody is seeking perfection, So nobody is willing to, lose a baby and have a attempt next time or something like that.
That's true.
So the whole generation is looking for that 1 or 2 normal babies in their family.
That's true.
And the pressure is driven from the patient to the doctor.
Okay.
Doctor, are you sure nothing will go wrong? Like for an epidural, if they were to ask Dr. Ketan, are you sure it's a 100% safe thing? The same husband doesn't realize that just for the fact that his wife is pregnant, if it was USA also, 9 out of 100,000 women die primarily because of the pregnancy, childbearing, and first week, 6 weeks after pregnancy. So he's taken the chance of losing his wife
dying,
9 times out of 100,000. So then his concern for epidural should not be so much,
Okay.
So I think we have to, and shouting from the rooftop against doctors and all has become a little fashionable.
Okay.
With no support from anywhere, So I guess you got to keep doing what you do best. And then leave the rest to the world to decide.
I can just add a little bit to both this thing. There's a false heroism which is attached to, tolerating labor pains, which is grossly misplaced. The right to pain relief is everybody's right. And this started, when we were in residency years ago, and we, in a government hospital, your patients are absolutely unaffording. And a callous attitude sorts to kind of pervade even medical students that she's in labor, she's going to scream. But we had a professor who said, this is wrong, The right to pain relief is everybody's right. And with advances in medical care, if we cannot afford that, we're doing the society a gross injustice. So, that level of awareness has to spread. And it has to come even from doctors. Doctors shouldn't be lazy in saying, oh, now I have to call the anesthetist. He'll come and give the epidural. It's such a big pain to wait, and it increases the cost for the mother. That's okay. That's okay. The right to pain relief is a right. The mother can choose to accept it or reject it. And with what Dr. Pagdiwala said, even from, say, our grandmother's time to our mother's time to now, such better diagnostic modalities are now available to pick up small problems along labor, when the lady is in labor, and even before labor, that it's easy to predict which baby or which mother is going to have trouble while giving birth. And so many cesarean sections are done preemptively, anticipating that this mother would kind of likely, or this baby would develop a problem later on. So nobody takes that into account, and nobody calls it a cesarean section anymore. It's either a vaginal delivery or a cesarean delivery, and both of those are very valid methods now.